Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. And this evening I'm going to be discussing case number 00287, a 13-year-old Shih Tzu with symptoms really of thunderphobia, anxiety. There was also polyps, and we did see some dental tartar as well. And the question is, if we have symptoms here, genetic expression, then what's going on the inside that might create these as we move in this direction? So, first of all, is there anything chronic going on? The answer is no, because that would be less than 47 and going on for greater than 3 months. So we didn't have any of those. But the acute phase, we had skin, stomach, and joints. And so how does that relate to anxiety and some of these things over here? Well, first of all, if we look at the emotion of anxiety and also the emotion of worry, these are things that, and really even fear, we think about emotions related to thunderphobia. On the outside, the emotions for the heart is anxiety, stomach is worry, kidney is fear, liver is really anger, and lung is going to be grief or melancholy. Why does this always happen to me, kind of thing. So when we're dealing with really these three in terms of thunderphobia, the joints have a relationship to the liver, which is supportive for the heart. And so if we have joints that are stressed or inflamed, it's going to contribute to anxiety. And so thunderphobia can be the tipping point for that. So thunder and lightning, change in barometric pressure that can affect the joints. So there can be joint soreness, and that can lead to the storm anxiety. The other thing over here is stomach, so GI tract. And we think about worry. And the heart supports the stomach, the liver controls the stomach. So if we have joint inflammation that's affecting the liver, we can see the stomach being affected, and then the emotion of worry, and that contributes to thunderphobia. And then down here for the skin, certainly the lungs, if we see the stomach is supporting the lungs, the out point for inflammation is going to be to the skin. And so when we look at it in terms of how things affect each other, we see symptoms affecting and systems affecting each other in different ways. And so even though the symptoms may express out here as nervous system, we don't see where the nervous system was involved. But actually the joint, skin, and also the stomach were the biggest contributors to that. So how do we balance that out? Well, we take hemp oil and we clear the skin, stomach, and joints. And also nutritionally, we think about reducing carbohydrates in the diet, because carbohydrates contribute to stress, increasing a little bit of the fat in the diet, and also a moderate amount of protein. So we'd want to do a nutritional consult and determine what type of food we're eating right now in terms of how that matches up with trying to reduce anxiety. And then we can also consider anxiolytics, but things that try to reduce anxiety often medication-wise don't work as well because of the underlying patterns that are going on. So once we clear these up, one of those medications may help, say such as acepromazine, for example, or even benzodiazepine and products like that can be helpful for controlling anxiety, especially during thunderstorms. So hopefully this video will help you, and give us a call 847-541-4005 if you have any questions, and then certainly shoot us an email if you have questions after hours. Thanks so much.